Bismillahirrahmanirrahim. Hello everybody. So a 35-year-old woman, gravida 4, para 0, abortion 2, comes to the office for her first prenatal visit. Her last menstrual period was 7 weeks ago and she is concerned about a recent episode of vaginal bleeding and cramping. A home pregnancy test was positive just after the patient missed period. Around that time she experienced nausea that has since subsided. She has had one normal term delivery and two early first term losses. 6 months ago, she had an episode of sudden right arm weakness and slurred speech, which resolved spontaneously in approximately 2 hours. The patient takes prenatal vitamins and no other medication. She weighs 75 kg and is 157.5 centimeter tall. BMI is 30 kg. Blood pressure is 140 by 80 mm of Hg. Pelvic examination show a closed cervix, no vaginal bleeding, and a slightly enlarged irregular shaped uterus. Ultrasound show an empty uterus with one subserosal fibroid about 2 cm in diameter. Beta HCG is 23. Which of the following maternal factor is the most likely cause of this patient miscarriage? Choice A, Baylis maternal translocation. Choice B, demyelinating lesion. Choice C, fibroid uterus. Choice D, hypercoagulability. Choice E, insulin resistance. Choice F, subclinical uterine infection. Choice G, thyroid disease. So first of all, they are asking that the patient is having the miscarriage. As we already see here, as we already know from the question, they are asking that there is two abortion. They already mentioned here. I will highlight also here. Two abortion. The patient experienced two abortion previously. Two abortion. Now come to the diagnosis. First, we have to diagnose the question. That what are the diagnosis of this question. So as we already see here, that this is the first hint that the patient is experienced two abortion in previous time. This is the first. The second one is that the patient also is concerned of recent episode of vaginal bleeding and cramping. So this is the also abortion, because the patient experienced vaginal bleeding and cramping. So this is the second hint. The third hint is the patient says that I have an episode of sudden right arm weakness and slurred speech. This is the third hint. And we can go toward the fourth hint. So the patient also says that on ultrasound she having an empty uterus with one subserosal fibroid. This is a fourth hint. Let me revise again. The first one is that the patient is experiencing abortion. Previous abortion 2 times. The second option is that the patient experienced recent episodes of vaginal bleeding. Recent episode of vaginal bleeding. The third hint is right arm weakness and blurred vision. Right arm weakness and blurred vision. This is the third hint. The fourth hint is that on ultrasound the uterus is empty. Uterus empty on ultrasound. This is the fourth hint. So based on these four hints, the diagnosis of this question is. So based on these four hints, the diagnosis of this question is antiphospholipid syndrome. How? So the correct option here is choice D, hypercoagulability state. So the diagnosis of this question is antiphospholipid syndrome. So why antiphospholipid syndrome and why the choice D is the correct one, hypercoagulability? Because this patient having antiphospholipid syndrome, so the diagnosis of antiphospholipid syndrome can be made if there is a vascular thrombosis, transient ischemic attack, or stroke, as seen in this patient. I will highlight again, as seen in this patient, sudden right arm weakness and slurred speech. So this is a So this is a transient ischemic attack. And plus there is a pregnancy complication, for example recurrent miscarriages. I will also highlight it here, abortion to recurrent miscarriages. Antiphospholipid syndrome is an autoimmune disorder in which autoantibodies are made against membrane phospholipids. The antiphospholipid syndrome associated autoantibodies mediated a hypercoagulable state that may cause placental thrombosis and hence miscarriages. So the treatment option for antiphospholipid syndrome is anticoagulable drugs, which is heparin and warfarin. So choice D is the correct one. Now come to the incorrect one. The balanced maternal translocation. So balanced maternal translocation is a cause of recurrent pregnancy loss due to embryonic chromosomal abnormalities. Choice B, demyelinating lesion. As we already know that demyelinating lesion, for example multiple sclerosis predominantly affect the women and is characterized by multiple focal demyelinating lesion and the optic nerve, spinal cord, cerebellum and white matter. But the multiple sclerosis does not cause the recurrent pregnancy loss. So this was also incorrect. Come to the choice C, fibroid. As we already know that yes, fibroid can do the recurrent pregnancy loss, but on this patient ultrasound there is subserosal, there is here I can highlight, there is subserosal fibroid on ultrasound. So subserosal fibroid is located outside the uterus cavity and is not associated with recurrent pregnancy loss. Come to the choice E, insulin resistance. So although obesity is a risk factor for involuntary infertility and type 2 diabetes, insulin resistant, but this patient conceives spontaneously several times and has no symptom of diabetes. So this one is also incorrect. Come to the choice F, subclinical uterine infection. So subclinical uterine infection, for example toxoplasma gondii etc., has been associated only with sporadic miscarriages, not recurrent pregnancy loss. Choice G, thyroid disease. So hypo or hyperthyroidism can cause infertility and recurrent pregnancy loss. However, most patients with untreated thyroid disease tend to have menstrual irregularity and fertility difficulty, but this patient has not the fertility difficulty because this patient experiences the recurrent pregnancy loss. Let's revise again why the choice D is the correct one. So first of all, we have to see that this patient is suffering from antiphospholipid syndrome. So what is antiphospholipid syndrome? Antiphospholipid syndrome occur in which the autoantibodies are made against the phospholipid in the cell membrane, which causes a hypercoagulability state. By making the hypercoagulability state, the thrombus will form in the placenta and hence the miscarriage will happen. So there are criteria for the diagnosis of the antiphospholipid syndrome. So the first one is recurrent transient ischemic attack, as we seen in this patient, that this patient is suffering this patient have an previous episode of sudden right arm weakness and slurred speech. This is the first hint. The second hint is recurrent pregnancy loss, as also this patient is experiencing recurrent pregnancy loss. And the third one is that for the diagnosis of antiphospholipid syndrome, there will be autoantibodies, anticardiolipin antibodies will be positive. So this is the diagnostic criteria for the antiphospholipid syndrome. So thank you.